The East Lothian Rehabilitation Service is comprised of occupational therapists, physiotherapists, exercise specialists, assistant practitioners, community care workers, technology-enabled care officers, a driver technician and administration staff. We're based at various locations across East Lothian, so that includes East Lothian Community Hospital in Haddington, as well as in Dunbar and Musselburgh. Our services see people in their own homes and in outpatient clinics and as inpatients. Discharge to Assess is one pathway within our East Lothian Rehab Service. And Discharge to Assess aims to prevent hospital admissions or to get patients home from hospital as soon as they can safely be discharged. We know and we understand that patients are happier in their own home and often improve more quickly here. We work with patients to identify any areas of difficulty they are having in managing at home and take them through a period of rehabilitation with our team.
The Discharge to Assess pathway is a pathway that has been set up and been in place for a number of years now here in East Lothian, and it's a pathway which supports people out of the hospital. We receive referrals from our therapy colleagues in the acute hospitals, and then myself as an occupational therapist alongside physiotherapy colleagues, we would assess that person in their own home on the day of discharge.
The reason that it's so important to see patients very quickly after the discharge from hospital is it often is that initial transition stage where patients may be coming home particularly anxious about their ongoing rehab, their condition. Potentially they may have had a fracture or quite a significant stroke, and they may be at home kind of concerned about what the future holds for them.
The first night home from hospital can always be very scary, but knowing that they've got that number off, that they can phone the occupational therapists or the physiotherapists if they have any issues, they are there to support them throughout the day of their discharge and right up until they get discharged from our service. We're there to support them.
I'm an 84-year-old lady who has had a fall in a garden, broken shoulder. Normally, I'm a very healthy, fit person who never wants to be out all the time. They've showed me what to do. They've helped in every way they can.
So from our point of view, from a physio's point of view, we're very much looking at mobility, function, sort of looking at equipment needs for patients, really thinking about their physical goals going forwards, and making sure that that they're safe in their home environment from a physiotherapy point of view.
My job is very much about what's important to that person, what motivates them, what do they need to do and want to do to be able to live independently at home. So that could be anything from managing from that moment you get up in the morning, first thing, getting yourself organised for the day, perhaps managing meals for yourself. If you're of a working age, maybe how you're managing to get back into work as well after illness or ill health.
As a society, we are now using technology a lot more, particularly since COVID-19. In East Lothian, we are keen to support people to know more about what the technology can do to help support themselves and their families stay as safe and independent at home. Within East Lothian Rehab Service, we have a new digital platform, abetterlife.eastlothian.gov.uk. Within this platform, there is a smart house. The smart house can take you through all the different rooms and to see what technology might be able to support you or your family or friends and loved ones to stay independent at home. These devices are usually low cost and easy to set up. This technology can control items in your own home in a different way, such as your heating, your lighting, security, and using this technology to help you achieve what you want to.
We go out to support them with, if equipment needs or if they're struggling with any transfers, we can practice their transfers with them. A lot of people want to get back to that full independence and not having to rely on their family members or friends to support them, and that's really what my main role is, working alongside occupational therapy and physiotherapy.
We meet so many interesting people, and it's really meaningful in that we are really providing a real specialist service to people in their own home.
Oh, I don't know how I would have done without them, to be perfectly honest. There's just no way I would have managed on my own. without the knowledge that they gave me, the help that they gave me to do things and how to do them properly and not hurt yourself.
Across East Lothian Rehab Service, we strive to keep patients at the centre of everything we do, focusing our services in a holistic and individual way.